Hi, everybody. I'm Dr. Michael Richmond, a double board certified cardiothoracic surgeon. So I feel it's important for everybody to learn the basics of any condition or disease they may be suffering from. So when you meet with your doctor, you have the ability to ask the proper questions, and therefore you'll have the knowledge to make collaborative decisions. While some doctors may not like to be questioned or challenged, any doctor who will not answer all your questions with candor and honesty and spend time with you is not the doctor you should be seeing. Remember, we always have choices. And if you don't jive with your doctor, you need to move on. So it's with that background that I want to talk about today's topic, which is thyroid nodules. Specifically, I want to talk about the diagnostic approach and management in adults. I'm going to do this in separate videos because I also want to talk about thyroid cancer, and it's beyond the scope of one video to talk about everything. So the initial evaluation in all patients with a thyroid nodule, either discovered by feeling or palpation, or incidentally noted on a radiologic procedure like a carotid ultrasound, a neck or chest CT scan, or a PET scan, includes a history and physical first. Okay, every patient should always have a history and physical when they see a doctor. A neck ultrasound and measurement of a thyroid stimulating hormone level, or a TSH level. So the next step after that depends on whether or not you have a low or high TSH level. So what do you do if it's low? Well, you do what's called a thyroid scintigraphy, and that should be performed in all patients with a subnormal or low serum TSH concentration. Now, I'm sure you're asking yourself, what in the world is a thyroid scintigraph? Well, it's a nuclear medicine imaging technique that evaluates the functional activity of the thyroid gland after administering a small amount of a radioactive tracer. The test provides a visual and quantitative assessment of thyroid tissue functioning, distinguishing between a hyperfunctioning, or what we call a hot nodule, and a hypofunctioning, which we call a cold nodule. Hot nodules are almost always benign, while a cold nodule carries a small but significant risk of malignancy or cancer. Scintigraphy also helps differentiate between diffuse uptake, like we see in Graves' disease, and focal uptake, which we see like in a toxic adenoma, for example, and can also identify suppressed extranodular thyroid tissue somewhere else. Now, what do you do if the serum TSH concentration is normal or elevated and meets the sonographic criteria for sampling? Well, then you do what's called the FNA, fine needle biopsy. At the end of this talk, I'm going to show you two charts, and I suggest stopping the video and taking a screenshot. And the first one is going to be the American College of Radiology TIRADS classification scheme and FNA guidance for thyroid nodules. And the second is the American Thyroid Association FNA guidance for thyroid nodules. So these help direct thinking about whether or not what is seen should lead to an FNA. And as I said, an FNA biopsy is the most accurate method for evaluating thyroid nodules and selecting patients for thyroid surgery. Nodules that do not meet the sonographic criteria for FNA should be monitored. Thyroid nodules are selected for FNA based on suspicious ultrasonographic characteristics rather than size alone, and the presence of suspicious ultrasound features is more predictive of a malignancy. But generally speaking, we do not do an FNA of nodules less than 1 centimeter, which is also 10 millimeters. So in tomorrow's video, I will talk about next steps that should be done depending on the results of the FNA. And remember, an FNA is done under just a little Novocaine or lidocaine, and it's just a small needle that either the endocrinologist or nowadays the interventional radiologist does. Not a big deal. Okay, so take a picture of the diagram, which I'm showing now, so that way you can bring them with you to show the physician, or at least when the ultrasound is done, you will have knowledge to know what needs to be done next, because sometimes you need to be your own advocate. And with that, I hope everybody has a good day. Thank you so much for listening. And if you need more information or guidance, you can go to my website at www.paladinmds.com and talk to you tomorrow. Thank you.